This is the Cancer Interviews podcast, and I'm your host, Bruce Morton. Our guest on this episode has survived a diagnosis of bladder cancer, but survivorship came at a high price as his bladder was removed in the process. He is John Morley of Haymarket, Virginia, and this is his story. Now's the time to hear it. And John, welcome to Cancer Interviews.
Thank you for having me.
And John, we want to start out the way we always do, and that is to learn a little bit about you outside of cancer. So if you would, tell us a bit about where you're from, what you've done for work, and what you like to do for fun.
Yeah, so I'm 62 years old, originally from California, but I've been living in Virginia now here in Haymarket for the past 30 years. I am a Navy veteran, and I spent 7 years in the military. And then most of my professional career has been more in the technology sector and marketing sectors. So currently right now I work for a major multinational tire company.
And for fun?
For fun, my wife and I, we love to hike. We do a lot of hiking. We love to travel. And we recently have taken up going on cruise ships. We find that we have a lot of fun there. And I'm actually going to be going on a scuba diving trip here, hopefully in the next couple of months.
Now, John, for all of us who are cancer survivors, there was that point in time in which things went from normal to abnormal. We thought our health was just fine, and something unusual happened, and that began the cancer journey. For you, how did that manifest itself?
Well, back in late 2021, early 2022, I noticed when I urinated that it wasn't looking quite right. It was a little bit off color. It wasn't something that was like blatantly red or bloody, but I noticed there was some discoloration, a little bit of pinking. And I said, well, you know, being a typical guy, I just ignored it, of course. And I said, well, it'll go away. And much to my surprise, it was a lot more than what I thought it was going to be. At first, I thought it was just a urinary tract infection. And, you know, I scheduled something with my primary care physician, went and saw him, and I said, I gave him the symptoms. I said, I'm seeing a little blood in my urine. And he said, well, it's probably a UTI or something. Let's go ahead and run some tests. And he ran some tests, and he said, no, your test came back negative, so I'm going to go ahead and refer you to a urologist.
And what happened after that?
So I went to the urologist and, you know, explained my symptoms to him. They did some blood tests on me, and apparently in the blood test, they saw some things. They wanted to go a little bit deeper, and they scheduled me for what's called a cystoscopy. And a cystoscopy, for someone who doesn't know what that is basically they take a camera and they put it up in my urethra. And that was quite the experience, if I must say so. It was done. I wasn't like they put me under or anything like that. I was in an outpatient situation and went in a room, and they told me to sit and relax, and they inserted a camera up and through my urethra into my bladder.
Was that painful?
It was more uncomfortable than it was painful. I thought it was kind of funny when the doctor or the nurse practitioner were kind of briefing me on what to expect. And they said, you're going to feel the urge to urinate, and you're going to probably feel the urge to tighten. Don't tighten up. It'll only make it worse. I'm like, okay, don't worry. And they had this big Jumbotron television where I could actually watch this camera going into my urethra. And they, you know, all of a sudden they put the camera in, and I just looked away because it was just too weird for me to even see that happening. And I just kept my eyes peeled on the big Jumbotron, and you know, it was just like the Fantastic Voyage. You know, it was just kind of going down into my urethra.
And was that what led to your diagnosis?
Well, it was really interesting. So I'm sitting there and watching this, and my urologist is kind of navigating down into my bladder. And I don't know what I'm looking at. I'm just seeing like a bunch of blobs and stuff. And it was really interesting. In a very matter-of-factly way, he just kind of looked and he goes, oh yeah, that's cancer. And it kind of threw me like, what? And I was a little taken back, like, that's a huge thing just to say kind of matter-of-factly, like, oh yeah, that's cancer. And I think he saw my reaction, like, whoa, what? And then he kind of backpedaled a little bit, because I don't know if he meant to just blurt it out like that. And he's like, well, we're going to have to run a biopsy, and we're going to have to check things. And like, he was trying to like talk me off the ledge a little bit or something. And I'm like, oh, okay. And I guess he took like a little tiny piece of it. And he says, well, yeah, we'll have to, we'll get back to you, kind of thing. So, they pulled the scope out, and, well, did they do a biopsy then or no? No, I had to actually go in for a, what they call a TURBT. That's where they actually go in and they do a little bit of a surgery where they actually remove what they see and do a biopsy on that. So he scheduled me for that. And then, so about, I don't know, a week later, here I am in a hospital going under general anesthesia to get this TURBT process, where they actually resected the mass or the tumor out of my bladder. And what they discovered is I had a 3-centimeter tumor in my bladder that they biopsied out. And sure enough, about 2 or 3 days after the surgery, my urologist called me and my wife in. We sat there, and he said, yeah, we see that there's cancer here, or, that there's definitely cancer here. And he goes, but we see it as non-muscle invasive. And I go, well, what does that mean? Well, that means it's contained to the bladder, and it hasn't protruded through the bladder into the muscle wall. And I said, oh, I'm assuming that's a good thing. He goes, yeah, no, that's a really good thing. He said, there's a lot of treatments for this. This is what we use, BCG therapy. It's basically something that they put into your bladder. They do multiple treatments. And your body, I guess, in fighting this BCG virus or bacteria that they put into your bladder, fights the cancer. And it's kind of like almost like an immunotherapy. And, he told me it's very, very effective. And I was like, okay. So because of course, once I kind of got on the bladder cancer train, I did like, every person on cancer, I think we get on Dr. Google and we try to figure out, okay, where's this going? What does this all mean? And of course I was thinking, well, if this is a later stage, I'm going to lose my bladder. I can, who knows what's going to happen? But I was a little bit relieved when he said, oh no, this is probably just, contained to the bladder. We'll treat it with BCG therapy. I said, okay, great. He said, however, I am going to send all your labs and pathology up to Johns Hopkins because I just want to get a second opinion on this. Obviously, we want to make sure we get it right. And of course, I'm like, great. I'm all for that, right? So from there, the next thing that happened was I got a call from Johns Hopkins, and they said, hey, we'd like to schedule a time for you to come up and go over your results. And I was like, okay. So my wife and I, we went up to Johns Hopkins. This is probably a couple of weeks later. And we met with the surgical oncologist there. He came out, and he was looking through all the, information that my original urologist sent up there. And he said, hey, based on everything I'm seeing here, I'm going to concur with your doctor that this is a, T1. It's contained in the bladder. You'll be using BCG therapy. It's highly effective. It should be fine. And we can either schedule that BCG therapy up here at Hopkins, or you can work with your local urologist down in Manassas. And I said, okay, so I'm good then. I'm not, going to lose my bladder. Or he goes, no, you're good. You should be fine. I was like, okay, I was really relieved. And he said, however, though, I'm still waiting. He says, based on everything I see, this is my opinion, I'm still waiting to hear something back from pathology, but I'm fairly confident that this has been contained. So I said, okay, great. So my wife and I, we leave Hopkins. I'm feeling pretty good about it. We go have dinner, and it's almost like a little celebratory. I mean, kind of weird to be celebratory about cancer, but everything that I've read about, this particular kind, if it's contained with the bladder, there's like good prognosis that you can get over it using this BCG therapy. So I was like, okay, great. And then I would say the next day, I'm driving home, and I was just pulling down my street, and I noticed on my caller ID that I had John Hopkins on my caller ID. And I figured, okay, it's maybe the oncologist or somebody to follow up with me on about something. So I answer the phone, and he goes, hey, this is, Matt Cates was my doctor. And he said, are you driving? And I said, yeah. I go, I'm just pulling up to my driveway. He said, okay, well, let me know when you stop. So I pulled in my driveway, and I go, yeah, what's up? He goes, hey, I got your pathology report back, and I looked at, we looked at it a little bit closer. I don't know how to tell you this, but basically your cancer is much more elevated than what we originally thought. You are definitely a T2, and it's muscle invasive. And by that time, I had done a little research, and I said, so that means my cancer has spread. He goes, it has spread, but, it's not metastasized. It's just gone through the muscle layer. And I go, so what does that mean? And he goes, well, I go, so is the BCG therapy out? He goes, no, we need to treat this very aggressively. He goes, you have a very high-grade cancer. And I go, okay. I'm sitting in my car going, oh, wow. And he goes, I need to get you in touch with an oncologist to start chemotherapy. And I was like, oh, so this is being treated with chemotherapy. He goes, no, what we're going to do is we're going to give you chemotherapy first, but we're going to have to perform what we call a radical cystectomy. And I go, is that what, I read a little bit about that. I said, is that where you remove my bladder? And he goes, yes, it's a surgery to remove your bladder. And I go, oh, and now this has hit me like, a ton of bricks sitting in my car. And he goes, not only are we going to remove your bladder, but we usually take the prostate as well and surrounding tissue just to be safe. I'm like, okay, I mean, when are we doing this? He goes, we need to do this, we need to get on this quickly. I need to get you scheduled for surgery. So this is all happening to me in like, I don't know, I think it was in February, March. Because we're going to try to get to the earliest I can get you in the surgery is June. He says, but we need to put you through chemotherapy first. And he said the chemotherapy will last it was about 2 or 3 months of chemotherapy. And then we got to give you some time to recover from the chemotherapy before we can do surgery on you, because this is a pretty big surgery. I mean, I basically have a scar that goes from my lower sternum all the way down to my groin. I mean, they just, kind of split me open like a deer. He said also, we need to get you into some MRIs and do some CTs and do some more imaging. So I went and I got some more imaging done. And when they were doing the imaging, they found a mass in my spleen as well. And he didn't know if that mass in my spleen was cancerous or not, but I guess the spleen, they don't typically do biopsies on that. So I got an opinion from another surgeon, and the surgeon said, yeah, you definitely need it. It was a fairly large mass in my spleen. Turned out it was actually a hemangioma, but it was so large that if I ever had any kind of trauma, like if I got in a car wreck or something, because it was so huge, I could bleed out before, they could save me. But they didn't know all that then, but they said, look, just to be safe, we're going to go ahead and do a splenectomy at the same time that they're doing everything else. And I said, wow, so I'm basically getting 3 organs for, my insurance company. It's like 3 organs for the price of 1, right? This big surgery that I was going to get at Hopkins. So yeah, I had a lot going on in my mind. I'm like, oh my gosh, and I always consider myself a pretty healthy guy. I love to hike. I like to be outdoors. I ran into some 10 milers. I was thinking, how can this be for me, right? And I wasn't like a smoker or anything like that. I mean, I'd smoked some cigars once in a while, and as a young man, I did smoke a little bit in the Navy, but I was just so surprised, it's the whole why me thing. But then anyways, I started the chemotherapy regime. They put me on the chemotherapy for bladder cancer, gemcitabine and cisplatin. And I started my rounds of chemotherapy. I was on chemotherapy for 2.5 months or so, going weekly. And of course, chemotherapy is, everyone's heard of it and what it does, and I'm no exception. It taxed me. Surprisingly, though, I did keep my hair thin quite a bit, but I didn't have a lot of the other side effects that people are experienced, but I was definitely wore out. Luckily, my job was very understanding about this, and I worked from home most of the time when I could. And yeah, I just kind of went through my chemotherapy, and it was tough, but it was mostly tired and taxing. And I remember I have an iWatch, and it would just constantly go off because it would say we're detecting tachycardia. My heart would just be pounding and beating very quickly. I thought it was like, wow. And of course I was calling my doctors and saying, hey, this is what's going on. And they were like, no, you're okay. This is normal. And working with the staff at the oncology department.
By the way, we're confident you'll be able to learn some tips and tools to help you through your personal cancer journey. But first, we'd like to invite you to please give us a like, leave a comment or review below, and share this story with your friends. Kindly click on the subscribe button below and click on the bell icon. That way you'll be notified the next time we release a cancer interview. And we want to remind you on cancer interviews, we are not distributors of medical advice. If you seek medical advice, please contact a licensed healthcare professional. So, John, you have had your bladder removed, you've had your prostate removed, you've had your spleen removed. That is obviously quite a bit that you have on your plate. You probably need 2 plates for all that. But with all of those surgical procedures, 3 of them, what was the toughest part?
I would say the toughest part was man, that's hard. The chemotherapy, of course, was tough because it went on for weeks. The recovery from the surgery was tough because, like I said, they kind of split me like a deer. They had to just go right through the middle of me, and all my abdominal muscles, my core muscles were. The thought of even doing a sit-up was just no way, But and the mental stuff, right? When you hear that you're going to get this cystectomy, I know logically that's probably like, they're going to take my bladder and stuff like that. But, emotionally you're thinking, oh, what's going to happen to me? Am I going to have like the anatomy of a Ken doll? As you start thinking crazy stuff, like, okay, how am I going to urinate and all that kind of stuff? And I actually, when they were scheduling it for surgery prior to, they asked me, you have multiple options. Because once you have your bladder removed, you have to figure out a way how you're going to evacuate your urine, of course, right? In the world of bladder cancer, you can do an Indiana pouch, you can do a neobladder, or you can do an ileal conduit, which basically is a bag that you wear where your urine drains into a bag, and, you drain the bag when you need to. And I looked at all the options, and what was really great about Hopkins is they had they gave me like a spreadsheet with all these names of different guys who had gone through the surgery, and next to their names was what they decided to do as far as their solution for urinating, whether it was the Indiana or the Neo or the ileal or the pouch. And I talked to a bunch of them, and I ended up going the ileal conduit into a pouch so I wear an ileostomy bag now.
Okay, and how difficult is that where urinary function is concerned?
You know, it took a little getting used to, but it's pretty basic. I mean, I just basically wear a bag. It's kind of attached to my, just to the right of my navel, and took a little getting used to. But nowadays, I don't even think much of it. It's changed the way I wear clothes a little bit. I don't tuck my shirts in anymore. And what else? I always try to look at the positive thing. I always joke with people. I said, when we go on long road trips, I can go for hours and hours and hours in the car. You don't need to pull over for me. I'm good. I got my bag, and I have a night bag that I hook into. That's like a 2-liter bag, and I can go all night. That's one of the other benefits too, is I never have to get up in the middle of the night to go pee anymore.
Now, with all that you went through, when did you notice things changing for the better?
Wow. You mean that post-surgery?
Yes.
I would say probably my recovery, I was in the hospital for a week, 8 days. And, came home. My wife had kind of set me up so I wouldn't have to keep going up and down the stairs. Kind of set up a room down in our basement, and I kind of hung out there for a few weeks, really kind of gaining my strength back. I was very weak, of course, after going through such an invasive surgery. But what I would do is every day I would try to get out and walk a little bit. And even if it was just walking to the mailbox or, walking just around in the neighborhood. And by doing so, I would say after about 4 to 5 weeks, I could really feel myself getting stronger and better, and walking really helped. I mean, I would highly recommend. That's one of the things they had me do. I couldn't believe I did this in hindsight, but literally just a day or two after my surgery, I got a million tubes hanging out of me, and I'm sore as heck. They were like, you need to get up and walk. And I'm walking the hallways of Johns Hopkins holding my IV carrier with all these tubes hanging out of me, and just kind of stumbling through the hallways. But it was probably one of the best things I could do, is to get out of bed and walk as soon as I could.
Now, through all this, you needed support. I suspect support came from your wife, maybe from family, from friends, but there's also an organization that is there to help people in their various stages of whether it's diagnosis or treatment, recovery, et cetera, and that's the Bladder Cancer Advocacy Network. To what extent did BCAN help you out during all this?
BCAN was absolutely instrumental to my recovery. They have just an amazing amount of resources available for people that are going through bladder cancer. My doctors at Hopkins are very tuned in, or very dialed into BCAN, and one of the first things they did when I went on my visit is they handed me all kinds of materials and literature that I could read about my particular cancer, all the different staging of cancer, and all the different available treatments. I did a lot of self-educating through the BCAN website, through the BCAN materials that are provided. It's just an amazing amount of resources. There's a lot of other stories of people who have gone through what I've gone through, and it was just very helpful.
And if somebody wanted to go to that website, where would they go?
They would go to bcan.org, bcan.org.
So there's BCAN, but also you're doing your part individually to help those diagnosed with bladder cancer. Could you tell us a little bit about that, John?
Yeah, a lot of people have asked me about my story, and I've submitted some stories on different Facebook groups and things like that. And so many people were asking me about my story, I decided I'd create a little website. It's called beatingbladdercancer.com. And there I post my stories. I have some blog posts that I'll be putting up there, and also a link, more importantly, to my YouTube channel, where I do little sessions, little 5, 10, 20-minute videos of each and every step that I went through as going through my journey. And I find that it's really helpful for people to just hear from my words what I went through. Obviously, I'm not doing any medical advice or anything. It's just my experience, what I went through, and what helped me.
Well, we want to make sure that people have that address if they want to go there as well. And again, that's beatingbladdercancer.com?
Yes, beatingbladdercancer.com.
Okay, excellent. All right, John, we're going to wrap up now, and we're going to wrap up the way we usually do. And to some extent, I feel like you've answered this question, but especially given your website, I feel this is right in your wheelhouse. So this is going to be an easy thing for you to answer, and it'll be a good, eloquent answer. If you ran into somebody who had just been diagnosed with bladder cancer, there might be a million things you want to say to them. But if there was one that you wanted to make sure, you want to make sure that this one point you have, you want to make sure that it resonated, what would that point be?
I would say educate yourself, because, of course, we fear what we don't know. And if you can go to resources like BCAN and understand exactly what you're going to be facing, that takes a little bit of the mystery and it's still, obviously, we're all going to be scared because cancer is scary stuff. But to be educated, to know what your options are, and to actively manage your care. Okay, you need to be very engaged with your doctors and ask them questions. And the best way to ask them questions is to be educated yourself. And there are a lot of great resources out there where you can do a little bit of your own research and be able to ask intelligent questions.
Excellent. John Morley, Haymarket, Virginia. Thank you very much for your time. You've told a great story, and you've dispensed a lot of helpful information that can come to the aid of somebody who has just been diagnosed or thinks they might be diagnosed. There's beatingbladdercancer.com, excuse me, your website. And then there's the Bladder Cancer Advocacy Network, BCAN or BCAN.org. So, John, one more time, thanks very much for being with us on Cancer Interviews.
Thank you for having me.
And we want to remind you, as we always do when we wrap up, if you are in a cancer journey, you or a loved one, you are not alone. There are people out there like John Morley. There are websites like beatingbladdercancer.com. And, of course, there's bcan.org that are there to help. So until next time, we'll see you on down the road.